Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Well, time now for our Thursday Community Service Report. Today, Muenster Memorial Hospital Day, and as always, very happy to be joined by the CEO at MMH, Brian Roland. How you doing?
Hey, it's good to be back. You know, I missed last month, and I figured out, a month without this show is like a day without sunshine. So definitely glad to be back with you, Dee, and to talk about some stuff going on in rural healthcare.
Yeah, and there's quite a bit going on, considering I don't know that the national healthcare thing is ever going to get worked out to everyone's satisfaction. I don't think that's possible. So let's kind of focus a little bit on how we approach that and other things. I know next week is National Rural Health Day, and there are a lot of things you guys deal with in rural health care that I'm sure some folks aren't familiar with, and I know providing quality service is no easy task these days with all the regulations and the question marks when it comes to health care.
Well, and it is, and I want to start off today's show, though, by wishing the best, and our hearts go out to the people in Sutherland Springs. Being in a rural community like that and dealing with that size of issue, our thoughts and prayers are really, really with those folks. And when you think about it, and I do want to wish everybody a good Thanksgiving coming up, and really take the time to be thankful for what you have, because truly in a blink of an eye, things can change. And people really need to take that extra effort this year with everything that has gone on in the last 6 to 8 months around our country, and especially the state of Texas. But yes, National Rural Health Day is next Thursday, the 16th. And what we're trying to do is really kind of focus on the crisis in rural healthcare. We probably give the best service that's out there when it comes to quality, direct patient care, patient satisfaction. But there's a lot of challenges out there that people, I don't really think, understand. Rural healthcare is in a deemed crisis status at this point. Since 2010, 80 rural hospitals have closed. There are 673 rural hospitals that are considered at risk, and 210 at what they call extreme risk, based on where they sit today and what happens to your community in rural Texas or any state if that hospital goes away, and you're dealing with challenges outside the norm nowadays, because with the demographic changes, if you're a hospital that is dependent upon Medicare patients and you have young people come into the community, that's great, but it really affects your hospital in an odd way. Good and bad, depending on what you're looking at. Inpatient volumes, people don't go to the hospital as much as they used to. And that's actually a good thing, because the government wants us to focus more on that outpatient care. And it really forces us to come up with building a better mousetrap on the outside to keep people out. And then, obviously the federal government, as great as they are, the reduced support that hospitals get. Mm-hmm. Every day, and I'm on the Texas Association of Rural and Community Hospital Board, we deal with stuff with the state of Texas and the federal government on the cuts. Every time you turn around, we're fighting something, whether it's cuts in Medicaid reimbursement, Medicare reimbursement. They're cutting out this program. They're not going to cover this. And you're trying to deal with things. It's an ongoing cycle. Winston Churchill said, "To improve is to change, so to be perfect is to change often." While we'll never be perfect, we are changing often. And Muenster is at the forefront of that. I mean, obviously, in our case, what can we do to ensure longevity in Cook County and especially our hospital district and Muenster proper? And so we're looking at, from a rural standpoint, what is out there to help us. You've got to tap into those entities that you normally don't tap into. And so the State Office of Rural Health, and this is a brand new thing that we just have up and going now, there is a financial and operational improvement grant And it kind of works with a bunch of critical access hospitals, the type we are, and we're going to kind of look at how we all do our business and what we can potentially do better to help us for that longevity. And it kind of gives us a starting place or a report card. Are we perfect? No. Are there things that we can do better? I'm sure there is. And as the CEO, if I can have that report card to figure out where do we focus on that aspect of it, while maintaining quality patient care, patient satisfaction, ensuring that our doors are open for our staff and our patients. We continue to look at the expenses that we have, the staffing, the services that we offer. We're working on kind of creating our own wound care program, getting the transitional care management up and going, and also the chronic care management. You have to look at things where the return on investment are going to be beneficial, not only for the community and the patient, but with all the factors that play in, what is that reimbursement going to be? Are we going to get our money's worth? And I think one of the really big things for rural healthcare nowadays is your staff has to be engaged in the process. Your staff can make or break your facility. They have to be out in that community talking about how great that healthcare is. Mm-hmm. They have to say, hey, you know what? My mother will go to that facility. Last month, before my mother passed away, my goal was to bring her up to our facility for her last couple of weeks. Our care is that good. Our nurses are second to none. My mother couldn't have been in a better place if she would have come to my facility. And I have no problem telling people that. Mm-hmm. I would not think twice. So rural health is an interesting, and it's an odd duck when it comes to certain things. And so our goal is, what can we do to enhance, to not be one of those crisis facilities, and to basically make sure our staff truly understand that rural healthcare, you should be proud. We do things that large hospitals can't do, even though they're a large facility. Even Muenster, in our ER, the things that we see, the patients that we take care of, a lot of times care isn't just fixing your problem, it's your emotional. It's being there to hold your hand, seeing that smiling face. And that is some of the greatest things that rural healthcare can give you. And I'm not saying you don't get that in the large urban facilities, mm-hmm. but we have sometimes a little extra time. Obviously, at our facility, we have the wonderful view, which that by itself definitely helps.
Yeah.
So you look at rural healthcare and you figure out, what can we do better? What don't we need to fix? And focus on the things that we need to fix. Mm-hmm. Winston Churchill said, if you have an important point to make, don't try to be subtle or clever. Use a pile driver. Hit the point once, then come back and hit it again, then hit it a third time with a tremendous whack. And that's what we have to do in rural healthcare. You can't be subtle and calm about what we're doing. You have to go out there with the pile driver, because our goal, our mission, is to be in Muenster a long, long, long time.
Mm-hmm. Yeah, and you commented on what you can give, and one of the things, and we live by it here at this radio station, one of the sayings we live by is give them what they can't get anywhere else. And you're really doing that, because in my opinion and my experiences in so many healthcare facilities over the last many years, people have become, I wouldn't say less than a patient, they're a number, but at Muenster, they're still a name. They're people that your people are get to know the patients. They get involved with the patients, and they really care about the patient. So they're not just patient number 4. They know who they are, and you don't get that everywhere.
That's definitely true. Yes.
Yeah, and I think that is so important. Not only do you get personal service, but you get the quality health care that you're looking for. And I admire you guys for facing the challenges and trying to come up with ways to circumnavigate this system as it is ever changing, and no telling what's going to happen next.
That's definitely true. Yes, sir.
Yeah. All right. Well, keep up the good work, Brian. It's always great to visit with you. Hope you have a great Thanksgiving, and we'll talk to you next month.
Definitely. We'll see you later.
All right. Thank you very much. There he goes. He is Brian Roland, CEO at MMH Muenster Memorial Hospital. And that's the Community Service Program here on Hometown Radio, 1580 KGAF.